Hello everyone, my name is Narcis Nizawayo and I'm a Human Resource Manager at Stronger Memorial Hospital. In this video, we are going to discuss about the uh, different jobs or positions that are in healthcare sector. So we will see together non-clinical jobs that are in health sector. We will see allied professions that are in healthcare, and we will see the different job responsibilities and educational requirements of nurses. I hope you will enjoy this presentation. Let's start by non-clinical jobs. Among non-clinical jobs, there are three examples that we can talk about. The first one is medical assistant. The second one is health information managers and technicians. And the third one is health administrators. Starting for starting by medical assistant, those are people who can interact with patients, but they are not required to be like doctors or physicians. So among their responsibilities, we can talk about to do check-ins, appointment, to interpret simple lab tests, and they can take some tests in laboratories and other responsibilities. Then they can do some follow-ups for appointments to make sure that they are done or not. And about their educational requirements, the minimum is associate degree in of medical assistant. The other one is health information managers and technicians. As you know, nowadays our health institutions are required to use electronic health system. So people who are technicians, they can help those institutions to operate electronic health systems as their technician. So among their jobs, they are to record medical information of patient and health information, so they can manage communication between doctors and patient. So those people need to have knowledge about laws that are applied in healthcare, medical terms, and other knowledge. Their educational requirements, they need to have to be a health information manager in health institution. You need to have a bachelor degree in that field, to have, as I said before, to have a knowledge on medical terminologies and some laws. The last but not least is health administrators, as it's true that uh, you can be a manager or an administrator of, excuse me, of a health institution without being a doctor or a specialist in medicine. So those are people who coordinate all activities of the health institution. They oversee the health institution, the activities, operations, everything that happens. So they have to be master's degree in business with concentration in healthcare. Uh, let's talk about allied health professions. We will see 6 examples, but let's understand what are them and their common responsibilities. So, as you can see, those are the people who work closely with clinical health providers. This means doctors, physicians, and specialists. So they sometimes interact with patient or not, depends on the type of profession. But they cooperate or they implement the work of specialists and providers. Common responsibilities include evaluation and assessment, keeping patient progress, prevention of disease, dietary nutrition service and other services, rehabilitation and health system management. Uh, Examples, we can say physical therapists, community health workers, pharmacists, physician assistant, dietetics, and dental hygienists. Uh, Physical therapists are those people who work with patients with injuries and other problems relating mobility. Uh, there exists physical therapist assistant who can assist a licensed physical therapist. It means that you can be assistant to a physical therapist who is licensed by the government. Community health workers, those are public workers who understands and has relationship with the members of the community that are being served. So among their roles, there is like they act like counselors, social support advocacy for the community, and other responsibilities. Pharmacists, those are the one who provide medicines prescribed by doctors and physicians or primary care nurses for patients. So they have information and knowledge about medication and their uses. They need to have 3 to 4 years bachelor's degree in pharmacy. The other one is physician assistants. Those are the people who work under physician supervision and they help physician to accomplish their tasks. They interact sometimes with patients. Sometimes they do some diagnosis, follow up to the patient, and other roles. Dietetics, those are people who have knowledge about food and nutrition and healthy meals and advise people about eating habits, help people to know which meal is healthy to be taken. So undergraduate degree of 2 years and even more. The last one is dental hygienists. Those are people who are oral health professionals. It means the oral health, including teeth. Uh, so they they can they they assess patients or tissues, help patients or consumers to be healthy in terms of oral health. They can develop dental hygiene diagnosis that are clinical database. They educate patients about oral hygiene and preventive oral care. Uh, let's talk about job responsibility and educational requirements for nurses. First one is licensed practical nurses. Uh, those are nurses who complement the work of registered nurses. We will see them later. Among their responsibilities, there is gathering patient health information, recording and taking some vital signs, providing personal hygiene assistance to patient, taking blood pressure, and conducting other basic care treatments, uh, supervising nursing assistance and aid. Educational requirements, they must complete approved educational program. They need to take National Council licensing examination and other educational programs related to nursing. The other type is called registered nurses. Registered nurses are those who can coordinate patient care and they monitor patient self-management like diet and exercises. They help patients about their health information. They provide medication to patients and follow up on them. They must have associate degree in nursing and some can have a bachelor's of science in nursing. They those who have bachelor in science, they have more responsibilities such as supervisory roles and they have higher salaries compared to licensed practical nurses we saw. So the last one is practitioners. Those provide primary and preventive healthcare services. Uh, they can work under supervision of physicians or doctors, but this can change in different states. They can prescribe medication with a limit. In some cases, they can prescribe medications. So these nurse practitioners have have advanced training in nursing, the minimum requirement is to have a master's degree in nursing. Some can have even doctoral or PhD in nursing. In conclusion, as you can see, you can be in healthcare sector without being a specialist in medicine. Some people have that perception that to be in healthcare sector, you have to be a specialist in medicine, but it is not. You can be a technician and still work in a health institution. Uh, these are the resources. If you want to know more about non-clinical healthcare careers, you can contact them. Thank you very much.